I told you that there are several categories of insulin. One is them rapid, short, intermittent, and long acting. So we categorized the insulin on base of the duration of action and also patient requirements or condition. So usually the rapid acting insulin we do not mixture with any other insulin. I said we do not mixture. So and also the rapid acting insulin is called rapid acting because they can start the work within a minute, right? So onset of action is very short. So when you give the patient, they can start the work within 10 to 15 minutes. So it is called rapid acting. They start the work rapidly. Imagine I have a diabetic and I ate too much in my dinner. Like I went to a program in a party, I ate too much and suddenly increased my blood sugar level. Then you give me the rapid acting. So we said the rapid acting insulin, we use the postprandial hyperglycemia. What does it mean, postprandial? It means if after the food, after meal, heavy meal, if blood sugar level go up, we give the rapid acting insulin. So the rapid acting insulin, usually we give them 15 minutes before the food, 15 minutes before meal, right? So also, what are the indication used for rapid reduction of blood glucose level, or we use the postprandial hyperglycemia. So here, another point I said, usually rapid acting insulin do not mixture with any. The example of rapid acting insulin is called Lispro or Aspart. There's a name, Lispro or Aspart. For NCLEX board, we must know the name, other name. Lispro or Aspart, other name is called Novolog or Humalog. So if the question comes, a patient is give the aspartate insulin, when the onset of action, or they said a patient for postprandial hyperglycemia, which one you have to use? They gave you the 4 options. One is called Lispro, but Lispro, if you do not know Lispro or Aspart is a rapid acting, we miss the question. And also keep in mind the rapid acting insulin start work very rapidly. So when you give the patient, you make sure the food is there. If patient develop hyperglycemia, you have to give them something. Or also I said, usually rapid acting insulin we give 15 minutes before food. So make sure food is available there. And short acting insulin. Short acting insulin, I said the short acting insulin, you can use the short acting insulin with the other insulin. I mean, short acting insulin can be used with a combination with long acting insulin or combination with intermediate insulin. Short acting insulin, other name of short acting insulin is called regular insulin, or short acting insulin is a clear insulin, clear, not a cloudy, clear. So short acting insulin The onset is half to 1 hour, 30 minutes to 1 hour, short acting or regular. And they go to the peak level after 2 to 3 hours. So as I told you, short acting insulin give 15 minutes before food or meal, but short acting insulin 30 minutes before meal or food, like 30 minutes before lunch or dinner. We give them short acting insulin. So short acting insulin usually administered before the meal, and this is also before the meal, 15 minutes before, but this is 30 minutes before the meal. And also, if the patient has a diabetic ketoacidosis, it is shortly called DKA. So also, it is the best use the short acting insulin for IV DKA, diabetic ketoacidosis. Right now, go for intermittent insulin. Intermittent. So intermittent insulin basically give twice a day, twice a day, right? And their onset is 2 to 4 hours and peak is 6 to 12 hours. They go peak. Peak means their activity, maximum activity after 6 to 12 hours. So when the medication in the peak level, the chance of develop hypoglycemia, right? So if you give intermediate insulin 8 a.m. at the morning, after 6 hours from 8 a.m., the chance to develop hypoglycemia, because after 6 hours, they go the peak level of their activities. Usually, some books say intermediate insulin we give after the food. Or some book also say this is we give them 30 to 60 minutes before the meal. So what I remember for my exam, rapid acting insulin before meal, short acting insulin before meal, intermediate and insulin before meal. But rapid acting insulin 15 minutes before, short acting insulin 30 minutes before the meal, and intermediate acting insulin 30 to 60 minutes before the food or before the meal. But what we has to know, the intermediate insulin we give twice a day, twice a day. The other name of intermediate insulin is called NPH. NPH. NPH stands for natural protamine hegadron. So sometimes NCLEX would give what are the stand for NPH, right? But you must know NPH is an intermediate acting insulin. Intermediate insulin is called cloudy insulin, but short acting insulin is called clear insulin. So if the insulin need to mixture between short and intermediate, we always withdraw the regular insulin first. And regular insulin, I say clear insulin, right? And NP is a cloudy insulin, NPH, cloudy. So regular insulin is before withdraw, then cloudy insulin, or then NPH insulin we should withdraw in the syringe if the need to the mixture. Other name of short-acting insulin is called regular or Humalog R, Novolin R, and NPH, right? Other name is called Humalin N, then Novolin L, and Novolin N. So easy to remember. We must remember for the exam. So short-acting, other name is regular, start by R, Humalog R, Novolin R, right? Ending by a R for regular, and regular are the short acting. And NPH, intermediate, but the name of them novel in L or novel in N. So N, it is, or NPH is related to the NPH, little bit clue to remember. And long acting insulin, and some book categorized very long acting. Usually the very long acting like glargine do not mixturing with others. And glargine or long acting ultra lenta, basically we give once a day, once daily, right? And onset of action is 1 hour. So after give this medicine, medicine can start after 1 hour onset of action, and there are no peak because this medication can work all day long, right? There are no peak, and this is the best option for the patient because who like to give the insulin more than 2 times, 3 times a day? Once a week, once a day is good. So continue no peak and use for basal dose, okay, especially during the night time. So long acting insulin like glargine or lantus is at the, it is better if we give the same time every day, same time every days. So here, if you like this handwriting, I just wrote how to remember the different insulin, easy way I write. Just I'm explaining. If you like, you can try it. Rapid acting insulin, example is aspart or lispo, 15 minutes before meal. Short acting, other name is called regular insulin, right? Or clear insulin, 30 minutes before meal for food. And short acting insulin, usually we use a combined or mixture with the intermediate insulin or long acting, not very long. And here the intermediate insulin, short, it is called NPH insulin or cloud insulin, usually take 30 to 60 minutes before meal. But here also to keep note, some book mention intermediate insulin give after food, but some book also mention 30 to 60 minutes before meal. And intermediate insulin, we should use twice a day. Twice a day. Onset is 2 to 4 hours, and peak is 6 to 12. And long-acting insulin is called glargine or lantus. It is good if we use same day, same time every day, and once daily. Onset is 1 hour, and there are no peak. And also long acting do not make a mixture. So rapid acting 15 minutes before, short acting 13 minutes before, and intermediate 30 to 60. So 15 multiplied by 2, 13, 30, and 30 multiplied by 2, it is 60, right? Easy to remember. Just multiply by 2 to 2. So before meal, but here we use the after food. So also example, rapid is aspart, short is called regular or clear, intermediate is called NPH or cloudy, long acting is called glargine. When we mixture the short or intermediate insulin, always we withdraw in the syringe regular one or clear one. Then we have to use the intermediate or NP1. So easy to remember RN. R for regular insulin withdraw first, then intermediate or NP insulin, RN. So you are preparing yourself for a RN license. regular insulin first, then NP or intermediate or cloudy insulin later on. Cloud is the intermediate insulin. So easy to remember. It is work for me. I'm just want to share with you if you like. I wrote here something, a short story, right? Here, RSILARNG, okay? Mean, I said, the story because I was in the Illinois for a long time. Short name of the Illinois is IL. So I wrote here, I said a story I make. A girl name is Glargin. Okay, a girl name is, actually the name is Garlin. The lady, her name is Garlin, but I changed her name little bit. Glargin. Glargin is the long acting. So ARN, her name is Glargin. ARN name is Glargin. Waiting in the rail station at Illinois. So rail station, Illinois, ARN glargine is wait for you. R for rapid acting insulin, S for short acting insulin, I for intermediate acting insulin, and L for long acting insulin, right? On the other hand, I said A, RN glargine waiting, right? A for aspartate means rapid acting insulin. Example is aspartate or Lispo. And short acting insulin example is regular insulin, right? And intermediate acting insulin is a NPH. And finally, L for long acting insulin and G for glargine. So here, railway station in Illinois, the type of insulin, and A, RN glargine, who waiting for you, it is the example of insulin. R stand for rapid, S stand for short, I for intermediate, L for long acting. Name of this medication: A for aspartate, R for regular, N for NPH, and G for glargine. So ARN glargine waiting for you, and she waiting a railway station in Illinois. So it is easy to remember because the NCLEX board, when you ask the question,